Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director. Today is Tuesday, November 24th, giving you the update from Albany Med. Let's jump into the COVID numbers. First graph, Capital Region, 8 counties. There's the numbers there. Fred, 148 in the hospital currently being treated for COVID. Any comments about that?
Yeah, Dennis, if you look at that graph, if you compare the ratio between the blue and the yellow's the intensive care population, the blue is non-intensive care, and then look back in the spring, clearly that ratio is lower now.
Okay.
Fewer people across the whole region in intensive care, which is a good thing.
That is a good thing. Next slide here is Albany Medical Center. Let's take a look there. First thing I would point out is we see no activity still here in the medical center of influenza. That would be the yellow bar. We haven't seen any except for that one day a couple weeks ago. So the activity is still all COVID.
Yeah, that's great that there's no influenza.
And then the next graph is the morning census here at Albany Med. There are currently 54 in the hospital, 31 on the floor. To your point, Fred, 13 in the ICU, 3 on ventilators. And it should be pointed out, in that 54, there is one pediatric patient, but it's a patient who's not requiring the intensive care unit at this time, which is great news.
That's right.
Fred, anything else you want to say about the numbers in the outpatient setting at all? Or?
Well, Dennis, we keep paying attention to what's happening in our community, and the positive rate is still kind of hovering, below 3 and the 2 to 2.5% range. I think it's important not to really focus on that. The hard endpoint that we're concerned about is people in the hospital.
People in the hospital.
And that number keeps going up. So even if the positive rate doesn't trend up all that much, obviously people are still catching the virus, getting sick enough to be in the hospital.
And speaking of patients in the hospital, one of the things that you pointed out is the ratio of those that need the ICU or a ventilator is lower. One of the things that we're attributing that to is possibly early intervention with therapeutics. Give us an update of if you get admitted to the hospital at Albany Med, what's the likelihood that you will get convalescent plasma or remdesivir?
Dennis, the vast majority of people are getting both of those drugs when they come into the hospital. So almost no one is coming in and not getting one or both of those therapies. And then, of course, if they wind up in the intensive care unit, dexamethasone has been shown to be valuable there, and they're all getting that in the intensive care unit as well.
As I sit here, it's pretty remarkable because I can remember the first time we spoke about convalescent plasma being used and remdesivir, and now it becomes standard of care.
Standard cocktail.
Very good. Fred, there's another thing we've talked about in the past. It made some news recently, monoclonal antibodies. Is that something the medical center has to give patients, or will we in the future, and where will that likely be delivered?
So Eli Lilly has been approved, as have Regeneron, to release their monoclonal antibodies. And basically this is a fabricated antibody against the virus. We'll leave it that way. So we've received 18 doses of the Eli Lilly product. And we're thinking that perhaps next week or the week after we'll receive an allocation of the Regeneron product as well. Now, Dennis, we have to infuse this over about an hour into a patient, and then we have to observe them for a little bit of time after that. We don't want to do that because these are positive patients. We don't want to do that sort of in the heart of the hospital, if you will. So we're looking for a place that's sort of separate, out of the mainstream, separate entrance, so they don't cross paths with other patients or a lot of our staff. So we're working on that. We think we'll have a plan probably for December 7th to start doing this.
Are we thinking about this as an outpatient therapy?
It is an outpatient therapy. It's only an outpatient therapy. And there are very specific criteria. So if you're over the age of 65, if you're under the age of 65 with certain comorbidities, you qualify for the therapy.
And this is the type of thing that we're looking to standardize throughout the region as well.
We are. So we're talking to our colleagues at St. Peter's and Ellis and Saratoga Hospital, Glens Falls, etc. So we're all going to hone in on the same approach to this. We think that the distribution of this will be kind of limited in the beginning. As I said, we have 18 doses. That's our first aliquot. So not a lot of it will be available right away.
Other good news, we have a third major pharmaceutical company this week which announced that they have results on their vaccine, and they believe, like the first two, it is safe and effective. So now we have Pfizer, we have Moderna, and now we have AstraZeneca, 3 major pharmaceutical companies that we think are close to having some approval.
And the AstraZeneca one is kind of interesting, Dennis, because it sounds like half dose as your first dose,
right,
followed by a full dose as your second dose, has efficacy or is as effective as the other 2 vaccines.
Right.
And it's a more standard kind of vaccine, so I think it's easier to produce. AstraZeneca has talked about having 150 million doses available by the end of the year.
That's incredible.
So if that all pans out, that's terrific news.
You had mentioned in the past that we have a group here, multidisciplinary, working on when the vaccine comes in, how we will prioritize it, how we will administer it, all the logistics involved in that. One of the things that you did is you asked us to poll our workforce and said, what is our willingness to get the vaccine when it comes in? Some very positive results.
Yeah, Dennis, I thought it would be important for us to understand, how willing our staff would be to take a vaccine. And interestingly enough, 1,100 have responded thus far to the survey. And to the simple question, would you take the vaccine when available, yes or no, over 80% of them said yes.
That's remarkable.
So that's terrific. The national polls, I think, are moving in that direction as well. But this is really good finding.
All right, very good, leading from the front. Another area which we want to talk about is the rule set related to members of the workforce who have people in their household who may be quarantined. So let's take this in 2 parts. And this is something that was sent out in a messenger today to update and clarify this position. That's right. If you are an employee and you have a member of your family or your household who is quarantined because they have been exposed to somebody with COVID, they're home quarantined, you as an employee do not have to quarantine. You can continue to come to work. We want you to self-monitor for symptoms and temperature. But just because your household contact is quarantined, you don't have to.
That's right.
Now that does change if the person at home is positive.
So if someone you live with, a spouse, a child, is positive, you can't come to work. You have to be quarantined at home along with that individual.
Because we consider that to be a high-risk exposure.
Very high-risk exposure.
All right, very good. So a lot of good update information there on COVID. Let's talk about labor action. Fred, that's next Tuesday. I think we want to have a couple simple messages today. My first one is to all the members of our workforce, nurses or anybody who will be coming in that day, we thank you. We thank you for coming in and making sure that our mission goes uninterrupted here on this campus.
Dennis, the safety and quality care that the medical center provides is very important to both of us.
Right.
Both of us, our families come here and get their care.
Absolutely.
So my message is to the community, Albany Medical Center is safe for you today, and it's going to be safe for you on Tuesday, December 1st. Don't delay your care.
Absolutely. Absolutely. Let's end it on some Thanksgiving notes. Fred, I'll be working here in the emergency department on Thanksgiving. I think you're making some good food.
So Dennis, your stress relief is to work in the
That's
ED.
Right. That's
My
right.
stress relief is to cook.
Okay.
So I've made duck ravioli, which will be with a butter sage sauce as an appetizer for a relatively small number of people who will be at my house.
Keep it safe.
Absolutely.
We did have some members of our workforce today, led by Jen Humphrey and Fran Alpert, who collected a group of employees, and they actually delivered some food today with Equinox.
Yes.
And they're going to do it again tomorrow. They went to over 100 places, I think 130 in Albany and Troy, and they did it in a safe way. I think we have a picture of them out there wearing masks, but delivering food, and it's wonderful.
Yes.
It's wonderful.
Very, very good.
And we thank the facilities folks and security for helping them with that as well.
Yeah.
Any final notes before we
other than Happy Thanksgiving? No.
Same. Happy Thanksgiving to every member of our workforce. We thank you all for everything you do. We're thankful for you. We'll see you next week. We ask that you once again please take care of yourself, take care of each other, and we'll see you next week.